Hey, this is Dr. Mort Orman, and we've been talking about pain this week, mostly emotional pain, but I also mentioned something about, might talk a little bit about physical pain. And I'm standing here today outside the house where my parents moved our family almost 50 years ago, and where I lived through high school, and where my 92-year-old mother, who's a widower now, still lives today. And I'm here to pick her up to take her to a dental appointment. And as I was thinking today, what kind of subject could I talk about today that has to do with pain? But I have to pick my mother up to take her to the dentist. I said, wait a minute, could there be a connection there? Could there be something about pain and dentistry that we could talk about today? And I went, yeah, I think there's a connection there. Actually, there's a couple subjects we could talk about that have to do with pain and dentistry. Some of them due to physical pain, and some of them have to do with emotional pain. So I'm going to go pick up my mom now and take her over to the dentist's office, and I'll continue this video once we get there. Here we are at the dentist's office.
In there now?
That's my mom.
Anything?
This is another old bridge.
Oh my goodness,
Yeah,
you have a collection.
I have a bridge.
Okay.
I have a couple of things.
I'm here in the dentist's office with my mom, and this is my old high school buddy, Dr. Leon Katz, who's going to be evaluating her today. And Leon and I spent many a late night at his house studying got ourselves both through high school together. So who knows?
Somehow.
Who knows what our lives would have been like had we not supported each other. But Leon's going to evaluate my mom now, and I'll talk to you later. Hi, I'm back home now after dropping my mom off after she finished her dental appointment today. So I want to get back to the subject of pain and dentistry and the connections between the two. And I want to talk a little bit about it from two perspectives. One, from the perspective of being a patient, as we all have probably been, and the type of both physical and emotional pain, the anxiety, the dread of going to the dentist that we can experience. And then I also think we need to recognize that there's a lot of pain on the side of the dentist. There's not physical pain there, but there's a lot of emotional pain and difficulty. And there's actually very high stress levels and suicide rates within dentists. So we ought to look at pain in both directions of the relationship. So with regard to being a patient, as I said, we talked about the emotional pain, sometimes the anxiety, the difficulty in going to a dentist, being afraid to go. But let's talk about the physical pain for a second, because there are things you can do to modulate the physical pain. Now, a lot of times you're not going to be able to avoid it completely. There's going to be some pain. But as we talked about in the last video, the more you resist something that's going to happen anyway, the worse you make it. So, yeah, there may be some pain involved in certain dental procedures and certain types of examinations, but the best thing to do is not to tense up, not to resist, and to be afraid of that pain, because that just makes your muscles all tight, your body all tight, and probably increases your pain sensors to some degree and can actually aggravate the pain. But either way, it's not going to make things any better, for sure, and it may in fact make things worse. So the best thing you can do is to really relax and go with the pain. Allow the pain to happen. Now, I'm not saying that in a masochistic kind of a way. I'm saying is, as long as you're going to have the pain anyway, you might as well try and relax your body as much as possible. Maybe relax your mind, maybe distract yourself. I know sometimes when I'm sitting in a dental chair and about to have something painful done, I'll do some little meditative processes. I may focus my attention on, the feelings in my toes and in my feet, just to keep them, focused on that particular part of the body. Also, sometimes before I go to the dentist, I'll take a couple of Tylenol pills just to take a little bit of the edge off the pain. There's no harm in doing that. If you find a medication like Tylenol that's very safe in general and doesn't have a lot of side effects or addiction possibilities. But the main principle here is, just like with emotional pain, when we resist it and when we fight it and when we tense up around it and when we do anything but accept it and embrace it and go with it, and then find strategies and techniques that can help minimize our pain. That's, regarding dental pain, that's probably the best thing that we can do. Now, on the side of dentists, as I said, there's a lot of stress in dentistry. There's a lot of emotional difficulties that dentists have to experience. I mean, after all, you're a person who's inflicting pain on other people to make them better. Patients really don't like coming to see you, and at a certain level you experience that. So there's a lot of difficulties around pain that dentists have to put up with, not to mention all the other stresses that dentists can have in their lives. running an office, having a staff, having a small business that they have to operate, and then whatever else is going on in their personal life and their family life. So, and the pressure of one on the other, the professional demands affecting one's personal life and one's family relationships. So there's a significant problem there with emotional pain on the side of dentists. And I've had a couple of patients that I've worked with in my coaching program who were dentists and came to me because the stress was just getting too much for them and they wanted some relief, and fortunately was able to help them. So if you're in that situation, if you're a dental professional or any other kind of professional, a doctor, a nurse, a lawyer, an accountant, any other kind of professional, and you're having a lot of stress or problems associated with your profession or with your life, I'm here to help you. I've got a coaching program that I can introduce you to and can help you deal with some of these issues. All you have to do is go to my website, docorman.com, DOCORMAN.com, use the contact page and send me a message and leave your phone number, and I'll be happy to call you and we'll have a conversation about it. This is Dr. Orman. See you next time.